Stand by.
Welcome to tonight's program, Empowering You, a series of programs provided by the Greater Dayton Area League of Women Voters in partnership with our friends at DATV. As the League of Women Voters of the Dayton area, our goal is to provide unbiased, nonpartisan information on issues that are relevant and important to our friends and neighbors throughout the Greater Dayton area. I am Erin O'Brien, a member of the League of Women Voters and your host for this evening as we discuss tonight's topic, healthcare issues. Our guests for this discussion are Dr. Michael Doan, the Medical Director for Public Health for Dayton and Montgomery County. Dr. Doan is certified in internal medicine and in public health and is also a fellow of both the American College of Physicians and the Royal Society for Public Health. Sara Hackenbracht is the President and CEO of the Greater Dayton Area Hospital Association, GDAHA. In her role, she sets the vision and strategy for a team of dedicated staff that serve the needs of the Dayton region's 29 hospitals and health systems in 11 counties. GDAHA serves its members' community, quality, and innovation needs that often require regional leadership in advocacy, education and awareness, health information, technology, and emergency preparedness. And Helen Kelley is the Executive Director of the Alcohol, Drug Addiction, and Mental Health Services Board for Montgomery County, Ohio. Before moving to that position, she was Special Assistant to the President of Central State University and concurrently served as Interim General Counsel and Secretary to the University Board of Trustees, as well as an adjunct professor. And Dr. Matthew Norgie Jones, also known as Dr. NJ, is on the phone with us tonight. He is a primary care doctor and healthcare advocate who works for a community health center in North Dayton. He is the Associate State Director for Single Payer Action Network, SPAN Ohio, a statewide organization working for healthcare for all Ohioans. Thank you all for being here tonight. So tonight we are discussing healthcare. Healthcare challenges are especially relevant right now. In the midst of the 2020 U.S. presidential election, Medicare for All has become a key point for the Democratic Party primary. So tonight we will discuss Medicare for All, the price of medications and how they can be stabilized or decreased, and the mental health needs of the community. So I'll begin with Dr. NJ, who we have on the phone with us tonight. Dr. NJ, could you give us an explanation of Medicare for All and how you think it could help Americans?
Sure. Thank you so much for having me on the line. Obviously, giving a quick overview of lots of information, but Medicare for All, or single payer national health insurance, is a system in which a single public agency organizes the healthcare financing, but the delivery of care is still in the same mostly private hands that it's in right now. Your doctors and hospitals still work for the same people they do right now. Under a Medicare for All system, all residents of the U.S. are going to be covered for all medically necessary services, including doctors, visits, hospitals, preventative care, long-term care, mental health, reproductive health, dental, vision, prescription drugs, and medical supplies. The program would be funded by combining our current considerable sources of public funding, like Medicare and Medicaid, with a modest new taxes based on the ability to pay. Over $500 billion in administrative savings can be realized by replacing today's inefficient, profit-oriented multiple insurance payers with a single streamlined nonprofit public payer. Premiums would disappear, and studies have shown that 95% of all households would save money. Patients would no longer have to face financial barriers to care like co-pays and deductibles, and we would regain our choice of doctors and hospitals, as well as doctors would regain their autonomy over patient care. In the end, we'd be able to get the care that we need to the providers that we like for a much lower cost than what we're paying right now.
Okay, thank you so much for that overview. Some do argue, Dr. NJ, that Medicare for All could ruin the quality of health care. What would you say to that?
Sure, that is one of those things that we hear a lot, and it's something that we can actually look at and answer right now. We can look at many other countries in the world that have either single payer or another version of universal health care coverage, meaning coverage for all of their residents. In those countries, they spend a fraction of what we spend right now per person on healthcare, and they get much better outcomes across the board. So when we look at things like life expectancy, infant and maternal mortality, on and on, they tend to do better than we do despite spending less money than we already spend. And we're actually in an ideal situation where we would be able to, as we design our Medicare for All system, take those parts of systems from other countries that would work best here and allow us to cut costs while actually dramatically improving the care that we give. We know that people aren't able to get the care that they need in the U.S. right now because either they're uninsured or just underinsured. The cost of premiums are skyrocketing, as have deductibles. All while our networks that we're forced to choose our doctors and hospitals from continue to shrink. None of this actually gives us better care. We have some of the best health care in the world available to us right here. What a Medicare for All system allows us to do is remove the complexity that's blocking our access to that care and put in place a simpler program that puts doctors and patients back in the ability to choose their care.
Thank you very much, Dr. NJ. So the next question I'm going to address to Sara. So Sara, others are afraid that the single-payer system would increase wait times and swamp emergency rooms because people can't get doctor's appointments in time. Do you think that's a possible result?
I think it's very important that when we look at a federal policy such as Medicare for All, we're really clear and understand what the local impacts of that kind of policy would mean. And for us in this community, we already have a population where 79% of our Dayton population are covered on either Medicare or Medicaid. And so that is already something that I think would be concerning, that we add more people into one of those two government programs. We're going to be shifting population who is currently covered on private insurance, making those people move into a system when they may already be comfortable and actually like their private insurance that they have through their employer. I think it could have significant impacts that we aren't necessarily prepared for at the local level, and particularly the impact to hospitals when you look at the shift of cost from private insurance to moving more people onto Medicare that doesn't reimburse at the level of costs that our hospitals incur for providing services. That is something that would be significantly concerning for us in the Dayton region.
Okay. And I guess I should have said too, if anybody wants to jump in at any time, even though I'm directing my question at Sara, feel free to expound on any of this. So thank you, I appreciate your answer. Michael, another argument against Medicare for All is that doctors would have to accept lower payment rates and that this could lead them to turn away new Medicare patients. Do you think that's a realistic concern?
Well, Erin, let me start with a survey from several years ago.
Okay.
And it turns out that providers and practitioners, physicians, and patients also were more satisfied with Medicare than any other health insurance program. So that I think the argument that Medicare is not good for providers is not necessarily the way that providers see it. Medicare has always been well rated by the people getting it. I mean, you hear providers complain, you hear patients complain, but when it comes down to it, compared to other insurances, it rates very well. The other thing is that the professional organizations, if you look at the American College of Physicians, American Academy of Family Practice, American Academy of Pediatrics, all of them have been advocating, in some cases for several decades, to reforms that go towards at least some sort of universal health programs for people or a single payer system. So that the professional organizations are also looking at that as a better way for them to be able to provide for their patients.
Okay, thank you. And really this next question is open for anyone. So what do you think we can do about the insulin prices that we're experiencing in our country and the skyrocketing costs of medications? Whether you have insurance or not, the costs seem to be increasing greatly. What do you think can be done about that?
We're both turning to you.
Okay, well, I mean, one of the situations in the United States is that all of the insulin that we have is manufactured. It's all based on human insulin, and it's all put together as a human insulin. Whereas porcine insulin or bovine insulin derived from animals is just much cheaper. If you go to Canada, they have much cheaper insulin because they will do that. In the United States, it's not available. It's not made, and FDA doesn't approve it, not because they wouldn't, but because it's not offered for sale here. So that to some extent, the marketplace has driven the United States to a very expensive, in a sense, artificial insulin based on the human insulin, as opposed to being able to use less expensive ones. Not everybody can take, people have allergies, so they can't always take animal insulins, but most people can, and that would be one way that the cost of insulin could be brought down. So that I think the marketplace in the United States is such, as we know, drug prices are often more than they are other places, that there are, I don't want to say agreements, there are provisions in place that may work against the consumer, and that's certainly something that over time will continue to be looked at.
Okay.
And I want to jump in. It's not so much about insulin costs coming down as it is about drug prices, especially with the population that we serve of people who are dealing with prescriptions to deal with mental illness and their substance abuse issues.
Yeah.
And the fact that those medications cost so much, and so often people are having to make choices between purchasing their medication or putting food on the table, as an example, because of the continued increases, the rising costs of necessary medications, and being able to do something, as you say, what can we do about that with insulin? What can we do about costs in general in order to make them reasonably priced for people to be able to have stable, healthy lifestyles with the use of their medications, as well as being able to have the sustainability for the other functions within their lives that give them a real healthy lifestyle overall.
Yeah.
It's a huge question, certainly not going to be answered in the time that we're here today, but it's really something important for us to think about as a society.
Absolutely. I agree. And Dr. NJ, did you have any input on this question for insulin costs and medication costs?
Yeah, I'd like to second what you just said about this being not just an insulin thing, and I realize insulin is it's one we talk about a lot because so many people are on insulin across the country. So we see that as a type 1 diabetic myself, I see that every day. But it is something that we've seen across the board. Antibiotics that used to be on the $4 list because they were generic that are now a couple $100 for the same dosing. And it's something that, there are kind of ways that people right now are trying to nip around the edges to try to get things like insulin specifically cheaper, but we can't really legislate every single drug separately. We have to talk about how we can actually make the prices as a whole come down. Not to beat the same drum before, but Medicare for All is an option for us all to be able to negotiate for prices that are lower. And we see that again in other countries that do this, where they can negotiate for prices that are more reasonable. And we need to still be able to obviously pay those drug companies the amount of money that they need to be able to manufacture and to make new drugs and things like that. But systems like the VA, or like I mentioned in other countries, are able to get much better prices while still not bankrupting the drug companies, so that we have a more sustainable system than what we have right now.
Thank you, Dr. NJ. I appreciate your input. So, Helen, I was going to talk a little bit today about community mental health, since you did bring that up as well. The Dayton area has really been through a lot of adverse experiences this last year with the tornadoes and the Oregon District shooting. So how do you think we can approach healing in our community and also make sure we're providing services for people that do need mental health care?
And I appreciate that you reference it as community mental health, because it is the situation of there being a healthy community. A community that has mental wellness is a thriving community. And we have been through a lot, but one of the things that's come out of that is one of the things that I would share is one of the antidotes, if you will, to everything we experienced last year, and that's the resiliency of the community based upon compassion, caring for one another, the supports, which are really important as a part of community mental health. You know, mental health is an integral part of physical health. It's almost the chicken and the egg kind of question, which came first. And a great deal of our physical ailments come from depression, anxiety, and other aspects. When we are able to have that sense of compassion, of caring from across community, that's the first step to creating a true mentally well community. But there are other things that we need to make sure that people have access to. Things like leisure, a sense of safety in community and in home, and those kinds of things are going to really be important as we go through this long-term process of recovery from what we've been experiencing. We're trying to make sure that everyone in this community has access to services as they need them, because the experiences last year were traumatic. How people respond to that depends upon how we're made up. For somebody who may have gone through the tornadoes and lost everything, they moved on. They were okay in terms of the experience. But there are others who can't step forward even at this point. So we have to make sure that there are an array of services that are available to meet people where they are, and to understand that we're not going to recover completely from 2019 in the course of a few short months. It's going to be years of recovery for us. So finding other ways to have leisure opportunities, finding other ways to address needs. Maybe it's something as simple as a judo class, having a massage, things that allow us to relax. For some people, it may mean really having that opportunity for meaningful work and being engaged in a way that allows people to pay their rent, their mortgage, rebuild relationships with family. So a lot of those kinds of things. Then there are those kinds of widget kinds of things that we can be doing as well. The typical kinds of efforts that we put into wellness in daily life, reading, reaching out to another person. One of the best ways to recover from pain, that mental health pain, is to reach out to another person and to do something for them. Bring them a flower, bring them the casserole. Those are the basic kinds of things. And then for others, we'll have to have long-term therapeutic modalities as well as medications to assist people in getting through the pain. Especially when you think about our children, our young people, because of the experiences of the tornadoes as an example. We have youngsters now who hear rain and dodge under the bed because they're so afraid that something else is going to happen as a result of that. And we're going to have to make sure that, we were talking earlier, threading the mental health components into everything we're doing as we think about physical health moving forward. It's going to be an important element of this, because the long-term resiliency depends on a sense of wellness and brain health. And doing whatever we can to keep our brains healthy is going to be really, really important to us. That's what the community is going to have to be focused on.
Absolutely. That makes a lot of sense. And I know with the community health aspect, integrated care is kind of a concept that wraps that all into one. Can anybody really explain what that integrated care model is and how that can help serve those mental health needs as well?
You want to start?
We can tag team that for many of us, because it touches many of our spaces in the healthcare industry and many of our organizations. Really, when we're looking at the integration of behavioral health, many times we're talking about how do we integrate that into our primary care practices in our community, so that when you or Dr. Doan or Helen or I go to the doctor, we are asked and checked on all of those traditional pieces, your height, your weight, your blood pressure, but then you're also asked a couple of key screening questions so that we know how you're doing and how you're faring from a mental health perspective. And that is something where traditionally, as Helen has said, it's been the chicken or the egg. We've addressed either physical health or we've addressed mental health, but those have been operating in very separate spheres. And so we're looking at this now opportunity in our community, in the state of Ohio, and through the Department of Medicaid, of how can we better integrate services for mental and behavioral health for all people in our community, but particularly in that point of care location of primary care, where ideally everyone should be going to their primary care doctor at least once a year for your annual checkups.
And the screening piece is so critical. I took my grandson to have his cast removed a couple of weeks ago, and the physician asked, "Do you feel safe at home?" And he's 8.
Yeah.
So he played with the question just a little bit, as an 8-year-old would do. But the fact that the question was asked and he actually thought about it and answered, that meant a great deal to someone like me who worries if our children are feeling safe at home, because we have enough evidence that many of them are not. And so to have the screening tools in place for young people, as well as for the rest of us when it comes to violence and other aspects of our health and that brain health that we were talking about, is so important. And if people aren't getting that, they need to ask for that. There are ways in which to engage in our physical health activities and screenings so that we are getting what we need from the system as well. Being able to stand up and to get what we need in ways that we haven't before.
Yeah.
The other thing I might add is, conversations around mental health are things that need to be happening outside of our provider offices, outside of our mental health agencies, outside of our hospitals. These really do need to be conversations that we're having in communities, that we're having with friends, but we're also having in the workplace, because we spend a lot of time with those people that we see on a day-to-day basis in the workspace, and we do need to start creating those environments where we're checking in with one another and having a proactive conversation. If we sense that something may not be right, that we have the space that we can connect that individual to resources and open that door for an additional conversation. And I think that's part of what we see happening here in the Dayton community. It's how we have responded to the last year's worth of incidents, that we've really started to band together and be willing to invite those conversations into a much more public space that we haven't traditionally been comfortable with.
Right. And I think that probably helps as well reduce the stigma around, mental health and accessing mental health care. It makes a lot of sense.
You've got us going now. Because that is critical, reducing stigma. We have to be able to talk about mental health in the same ways that we talk about other conditions, and so that we're able to normalize the conversation and stop having people fearful of sharing that they may have a condition. We also have to be able to educate ourselves in the community. So there are things like mental health first aid classes, so that people can identify the signs and symptoms that they see with someone and can ask them the hard questions if necessary, because that just may save a life. If you see that someone is struggling, for example, and you notice they don't seem to be operating within their typical sphere of activity, you can ask the question, are you feeling okay? Even asking if you suspect that someone may be thinking about ending their own lives. You ask the question.
so important.
They want to tell you typically, and if you ask it, you may save someone from actually completing the act.
Absolutely. Yeah.
Just to kind of piggyback on what you're saying, I mean, the access question is an important one and foundational. The second layer of that really is utilization. Are people actually using the services? They may have access, but they may not utilize them. And it could be that stigma and the fear of that keeps people from accessing those services. May also be something like transportation. May also be hours. If you've got a job and you don't have health benefits and you don't have sick time that you can take off, then you may not be able to make it to any place to get mental health or other care during regular office hours. We also know that last year, 50% of people that had health insurance either didn't go for care or delayed care because of financial concerns. So that one of the questions is, what's our health insurance doing for us if it's not letting people get health care that they need? And so the healthcare system as it's currently set up is really failing to accomplish what we in public health would hope would be what insurance would be able to do, to be able to not only let people have access, but allow them to utilize it without the financial burdens that people are facing with a lot of the high deductible plans.
Yeah, absolutely. And I know one of the newer modalities, actually it's been around for a while, but is becoming more popular, is the telemedicine and telehealth. And I know in areas where there might not be like youth, youth psychologists and psychiatrists, where we just don't have as many as we need, they're going in that direction. Do you guys see that as a benefit in your industry, for healthcare, or that could provide people more access, more opportunities for access if they can't have, transportation to get to the doctor?
I think it is one of the tools that we need to have in our toolkit for providers across the country, but particularly for those areas of the country that are rural, that may be more isolated, where you may have to travel an hour just to find the right type of behavioral health or primary care specialist for you to be able to seek the care that you need. So it's really, really important in those rural communities, but I think it is also something that we're looking at here in Ohio to provide access to services that maybe aren't located in that specific region.
And related to that, one of the other issues that we actually haven't mentioned yet tonight is that there is a shortage of people coming into this work. We're in crisis, so to speak, with respect to the workforce, because it's not easy work, but it's wonderful, wonderful work when you're involved in it. But just as Dr. Doe mentioned, hours, you can't work a 9 to 5 and really be of service necessarily to people in the way that you want to be in this type of business. So having the flexibility of scheduling and those kinds of things that might make this kind of work more palatable would be helpful, but we certainly would encourage people to consider this work because it is very important because of the way in which it makes a difference in the lives of people, and especially of our young people as they're coming up. And we're looking more and more at that younger generation and doing more early on with prevention than we've done in the past in order to have a huge difference in what happens in the rest of their lives.
Yeah.
And the one place that you do have that after 5 coverage is an emergency department, but that's set up for emergencies, not necessarily for what walks through the door. And this is a place where I think telehealth has been shown to be helpful because it does allow that after hours access, and it has, in some places where it's been looked at, it's decreased the emergency department usage. So that I think telehealth is going to have a role to play, but again, I think it needs to be better defined and developed.
And what Dr. Doan mentioned is really, really important, that the emergency departments that we have in this community are meant for true emergencies. And so we really need to make sure that when people are seeking care, they're seeking care at the right place and at the right time for their particular situation. And so if you were in a very dangerous, tragic car accident, definitely you're going to be probably taken to one of the emergency departments in the region. But if you're just having a little bit of back pain or maybe a slight headache, that is probably not the type of situation that we need to address in an emergency department, but would be better served by either your primary care doctor or an urgent care or one of the outpatient facilities that are available.
Yeah. And the costs are probably much higher too with going to the emergency room, right?
Very true. You pay much more out of pocket.
Yeah. I had a follow-up question for you, Helen.
Sure.
In terms of that mental health first aid that you mentioned, who is receiving that type of training? Where are we seeing that?
It's community-based training. It's offered free of charge. What's been wonderful is that it's a variety of people throughout the community. It's being deployed in schools, in the courts. Any citizen can sign up to come for the training we offer it at Adamus, as an example, or the training teams will come out into other organizations to provide it. It's an 8-hour training which helps you to understand the signs and symptoms and how to interact with someone who may be experiencing a mental health crisis, or at least to identify that there may be something going on that would be helpful for you to refer to someone else. It just gives the entire community insights in ways that they would have if someone were experiencing a panic attack or a heart attack, and normalizing the conversation so that everyone can help to save a life if necessary.
Okay, thank you. So we're getting towards the end of the program. Is there anything anybody else wants to say before we wrap things up today in terms of healthcare, especially with the election coming? Any major concerns or things to think about?
I think as you continue to look at the options for Medicare for All, it's really important to understand that I think that sounds like a wonderful plan, but the devil is going to be in the details. And any type of healthcare policy legislation ends up being thousands upon thousands of pages that we need to make sure that we really dig into the details and understand what the local impacts are going to be. So I think the concept is one that is admirable, but there are a number of factors in terms of providers, hospitals, doctors' offices, mental and behavioral health, the patient needs, the pharmacy needs. Are everyone's incentives aligned in that type of system? And I think that's what we really need to work towards, is full alignment. And I'm not sure that just one piece of legislation is going to get us there yet.
Okay.
And I would add one thing, and that would be parity of mental health services within any health care legislation, because it isn't there currently, and we tend not to be able then to fund it and to provide the services in the way that we would in other services.
Yeah. Thank you for that point. Well, thank you all for being here today. I really appreciate your time and your passion for what you do. It comes through very clear. So thank you everyone for watching our incredible discussion on healthcare issues in our country and community. If you have any further questions about this or upcoming programs, you can contact the League by mailing league@lwvdayton.org or calling our office at 937-228-4041. Thank you all in our viewing audience for watching LWV Empowering You. Have a great evening and good night.